Okay, it seems sadly as though it's an annual thing that we cover at Siren Radio. That annual thing being, of course, the challenges when faced with sickle cell disease, indeed sickle cell anemia, which is obviously connected with that. And there is still, regrettably, a fairly alarming racial and socioeconomic bias in the treatment of sickle cell disease. We see a recent survey suggests that 26% of patients receive poor care from general practitioners or family doctors due to their ethnicity, race, or indeed socioeconomic status. And to actually address this, we're delighted to actually welcome a range of folk, actually. First of all, Stephanie George, who is a sickle cell patient. How are you, Stephanie?
I'm okay, Alex, thanks.
Which is good. Okay. We've also got the carer of sickle cell patient. That's Cherie Brooks. How are you, Cherie?
Hi.
Excellent. And we've also got Dr. Paula Eleftheriou, a consultant hematologist at UCLH. How are you, Dr. Paula?
Good afternoon. I'm fine. Thank you very much.
Excellent. Stephanie, let's turn to you first. As a sickle cell patient, how is your lifestyle impacted by SCD?
So my lifestyle is impacted by the condition because it's just there every day, and obviously I don't know a life without it, but it does. No 2 days are the same. Like right now, I'm in pain and I've taken medication, and I'm being able to be here to talk to you. But there's plenty of times I've had to, I would start the day fine, and then I would end up in A&E that night. So many times I've had to cancel on friends at the very last minute, which I'm very grateful that I have a really good support system around me. My sister also suffers with the illness, so we kind of advocate for each other, and we're each other's support system. But yeah, it isn't a debilitating illness that's very unpredictable, and it does affect my everyday life.
So turning to Dr. Perla, I mean, we've heard obviously some of the aspects there, and clearly we're looking at this research findings. I mean, I find it quite depressing, really. I mean, what were your own sort of takeaways from this particular analysis of people who are living with sickle cell disease in the UK?
Well, I think I share completely your impression, Alex. I find it equally depressing. So we had the all-party parliamentary group report in 2021, followed by the SHAPE survey results a year after. And essentially what we see from those two reports and surveys is that actually the same unmet needs and problems persist. However, the good news is that indeed, many decades after seeing this disease being neglected and under-resourced and understaffed and under-researched, now we are making progress. And there is certainly, from the NHS England point of view, the motivation to commit to tackle the care inequalities and the racial and socioeconomic problems affecting our patients, which directly affect care delivery. So there is improvement, and to be more precise, we have now formed specialist centres across England, which essentially, in collaboration with the local sickle cell centres, wherever the patients live, are collaborating to ensure that each and every patient has access to a specialist centre where the care provided is according to the best standards that can be delivered in the UK. We also have the National Hemoglobinopathy Panel, which consists of UK experts in sickle cell disease, so blood specialists, but also people from other medical fields, such as heart specialists, liver specialists, specialists in bone marrow transplantation, psychologists, but also patient representatives, to ensure that all challenging cases who might be more complex than the standard ones and who might need more specialist input are discussed on a regular basis. So there's definitely work in progress, and not to forget to mention the very important aspect of teaching and education, which has been enhanced significantly in the last at least 3-4 years with rolling programs to increase the understanding and awareness of the management of sickle cell disease across the specialists involved, nursing and medical specialists.
I seem to recall from my A-level biology days that this genetic connection, genetic constituent with respect to this. Just to clarify, sickle cell disease, is that related to sickle cell anemia? Is it, again, a challenge with respect to, again, the genetic aspects? And indeed, can genetics serve as a possible cure in terms of future generations?
Very good question. So sickle cell disease is the most common genetic blood disorder globally and in the UK, and it's actually one of the most severe genetic disorders, full stop. It affects the red blood cells, and essentially what it means is that there is a 25% chance with every pregnancy, if two people are carriers of the sickle cell gene, to have a baby born with sickle cell disease. Yes, in terms of cure, genetic treatments are becoming available. They have advanced in terms of research and have reached final stages in clinical research. And we're really on the cusp of a very important time where we are keeping our fingers crossed and are very optimistic that there will be accessible to our patients in the UK as part of their standard of care. And of course, not everybody will be eligible for these treatments because they are high risk treatments associated with the use of, with all the risks that chemotherapy and cytotoxic agents involve, but selected patients will have the option of these genetic or gene therapy curative treatments.
Cherie, you've been listening to this clearly. You're a carer of a sickle cell patient. I mean, I was shocked to see that 91% of carers in the survey feel guilty that their child has sickle cell disease. I mean, obviously, we've heard from Dr. Pola there about the genetic aspect. What are your thoughts about this? I mean, do you feel as though progress is being made, or is that, that headline figure that 26%, over a quarter of patients receive poor care from their GPs or their family doctors due to their socioeconomic status, their race, their ethnicity? Is that something which you still feel is just outrageous?
I think there's so many aspects to pick up there. In terms of the guilt aspect, I feel guilty every day having a child with sickle cell. I wasn't even aware that I carried the gene until I was pregnant with him. In terms of the care, I have a son who's 16. I would say there has definitely been improvement in the care, but there is still so much more to do. As a carer for someone with sickle cell, actually the whole family are affected by it. Stephanie touched on the fact that we can't plan, at the drop of a hat, things change. I can send my son off to school and he'll be absolutely well. And, I'll get a phone call 10 minutes later to say he's ill. We've had to call an ambulance. So much changes day to day and it affects everyone. In terms of genetics, again, I'm not a specialist. There is a lot to do, but we are very, very hopeful about the treatment that is on the horizon.
I noticed, Dr. Pola, there are a number of fairly well-known folk who actually do have sickle cell disease. Some I think surprising, Neve Cusack being one, the actress, Adi Patan, Paralympian, of course, Richard Blackwood, actor and comedian, and indeed former footballer Ashley Cain. That possibly might help to a certain extent, but at the same time, do you feel as though, again, that question about progress, we won't be having this conversation a year from now where we're saying, well, I'm sorry, but you're living in that postcode area, so, sorry, you're not going to actually do well when it comes to sickle cell disease?
Sorry, if I understood your question correct, Alex, you're talking about whether we are making progress in terms of ensuring equal access. Yes, I mean,
exactly.
That is absolutely the huge unmet need for in terms of management of sickle cell patients. So to ensure that there aren't health inequalities, that there is equal access to care wherever the patients live, regardless of their postcode. And this is the reason why NHS England has recognised this unmet for years, for decades now, need, and has commissioned the establishment of the specialist centres, which work closely, or should be working closely, with the local sickle cell centres where the patients might be presenting with when they develop an acute complication, to ensure exactly that the care they receive at the local non-specialist sickle cell centre is exactly what they should be receiving at a specialist sickle cell centre. And if this doesn't work, or if this is not feasible, then the patient should be transferred to their specialist centre, wherever that is. But also we have to remember that sickle cell disease is not just about dealing with the acute problems, and the hallmark of this disease is excruciating, painful episodes, but it doesn't stop there. It's about preventing complications. It's a disease which can affect every single organ in somebody's body who has a disease, and it's about preventing organ damage and providing the patients with the right type of monitoring in the outpatient clinics, and offering them the treatment that they might need, and this is very much individualized care, to ensure that the risk of developing organ damage is reduced. And again, this is the role of having assigned to every sickle cell patient in the UK a specialist centre, which is what we have had commissioned by NHS England in 2020, but there is a lot of work in progress to improve this project.
Challenging times indeed. Almost coming to the end, basically. The pandemic we went through, did that also have a negative effect on people's awareness of sickle cell disease? Because clearly we had a whole range of issues there, which the NHS is still arguably recovering from.
I think that there are a number of issues. Obviously, yes, we had the pandemic, and in the pandemic, somebody with sickle cell still has to go through their blood transfusions. Obviously, excuse me, sorry. They're also at high risk of infection, so there is the awareness there. So there are a lot of things going on. The messages that I would say is what is really important is that people with sickle cell rely on blood transfusions. So again, we are asking everyone to consider donating blood, and also, especially from the Black and ethnic community, we need better matches. So we need people to be able to come forward and do that. But also that there is help out there. There are organisations such as the Sickle Cell Society that can really offer advice, help and information. So it's not just about World Sickle Day. It's about being aware of sickle cell 365 days a year.
Yeah. Sherry, many thanks for that. I think you've answered my final question in terms of where can people go to, what can they do to actually support the whole thing, and you clearly raised a number of organisations that can at least provide some help in the continuing line. We'll wrap up as we began, actually, by just turning to Stephanie. Stephanie, you've heard a lot there. You've probably had an awful lot of other interviews going through the course of this day and so on. Do you feel optimistic in yourself that actually, okay, just keep on going one day at a time and things will work out?
Yes, Alex, I do feel optimistic. Obviously, we have highlighted that a lot of work still needs to be done, but it's essential that we have these conversations and keep having these conversations, because that is the only way that change will happen. But we also need people to be receptive to these conversations and want to, facilitate change, because it is going to be a whole collective. We need everybody to be involved for change to happen, but to also remember that patients are, so obviously we live through this with experience. We are expert patients, so patients also have to be at the core of whatever change is going to happen.
Stephanie George, Sherry Brooks and Dr. Paula Eleftherio. Hopefully I got the pronunciation right there, Dr. Paula.
Perfect. Well done.
Splendid. Many thanks. Keep up the excellent work and keep on going.
Thank you,
Alex.
Thank you very much.